So just a little bit of background on me. I qualified as a diagnostic radiographer in the human medicine in 2012, and I did a couple of years in the NHS initially. And then in 2014 I got the job in Cambridge as a veterinary radiographer, and I've been there ever since. And I just absolutely love it, and I feel like I've learned quite a lot over the years, so I'd just like to share some of that with you today and hopefully make taking x-rays, looking at x-rays, radiation safety, all of that just a bit easier for you out in practice. So what we'll look at just in this first section is your role in radiography, so what you do, a little bit on legislation. I'm not going to go too much into that because you only need to sort of be aware of what's out there. How you can put that legislation and use it and put it into practice, and then we'll go into radiation safety, which is a bit more interesting. Okay, so by the end of this morning, this is what I would hope that you'll be able to achieve, so that you'll understand a bit more about your role in radiation safety in practice as well, for yourself and for your patients, and also for anyone you might be teaching. Be a little bit more up to date with the legislation. It has changed recently, so just to be aware of what it is and how you can put it into place if you need to, or how your practice should have put it into place for you. To understand some of the effects of radiation, so there's a couple of maybe a little bit gruesome images you might have already seen if you flick through, so I'm sorry about those, but it just tries to get the point across. And obviously learn how to safely x-ray your patients, which hopefully you already do. So I thought we'd just have a little discussion to start with. So when you take x-rays, what do you think is your role in radiography? So what do you have to do? Like, what are your responsibilities? If the vet comes to you and says, can you take some chest x-rays, what are you going to do? Like, what is your role?
To get a diagnostic image?
To get a diagnostic image, yeah, absolutely. What else do you have to do? Or know?
Know sort of the landmarks and where you're positioning.
Yeah, definitely. So know how to position correctly and be confident with your anatomy. What about when you've taken the x-ray, then what? Are you going to be the one to look at the image, or is it someone else that comes in and looks at your images? Vet comes in. Okay.
Yeah. We have to process them.
Yeah, you have to process them. Yeah.
Flip them and label them and all that sort of stuff, and then come in.
Great. Yeah, so they're the sort of things. So actually a lot of it's down to you. Actually, the vet then comes in at the very end and gives their opinion on it, but you're the one normally positioning, you're the one that's got to use the equipment and make sure it's working correctly, that you've selected the correct exposures, that you're doing the correct view as well. What about, do you have to, sorry, I'm just asking because I know, like, in first opinion practices, I don't know exactly how you do radiography, but are you responsible for sort of like sedations and monitoring as well? Do you have to do that as well as your actual job? Yeah, so that's quite a lot, isn't it? It's quite a lot of responsibility to have to be doing your sedation, making sure your animal's still okay, and be positioning things. Do you record any doses or things like that? Do you have to say like how many x-rays you've taken or anything like that? Is there something? Yeah. Yeah, so I guess what I'm trying to highlight is you have quite a big role in radiography, and it's quite a lot of things to remember. So I've just put some things around here. We haven't mentioned all of them, but some of them we have. So obviously you're going to be positioning your animals correctly. You've got to have a good understanding of anatomy. I've put evaluate radiographs, but obviously I know the vets come in and effectively say and have a look at them, but it's good for you to look at them and think, okay, yeah, that's diagnostic or not, and do I need to repeat it? What about PPE? Do you have anything to do with like the lead gowns and things like that? Are any of you responsible for no? So like I know some people are responsible for maintaining the PPE as well, but just making sure you wear it obviously as well, and anyone else that is working with you. I'm really sorry, I've forgotten your name. Jenny. You also mentioned annotating the radiograph. So by that I mean like looking at them, putting your markers on if you haven't already, flipping them, doing whatever you need to do with them. So you do all of that. And on top of all of that, normally you're monitoring your patient as well. So it's quite a huge amount to get going.